for everyone who doesn't know, I'm so excited. First of all, I just can't wait to get into it. But Dr. Nicole Pensak and I have known each other since I was like 14, I want to say, 14 or 15. So we went to high school together and recently reconnected when Nikki saw what I was doing with Mama Soul and creating this community of mothers. And I just want to introduce you first. So Dr. Nicole Pensak is a renowned clinical psychologist. She is trained from Harvard and Yale, and she is the author of the most amazing book, Rattled. Um, she's a she essentially specializes in postpartum mental health. So we're going to be talking about all things depression, anxiety, baby blues, mom guilt, mom rage, OCD. We're getting into it, even talking about, going back to work. So I just want to, first of all, ask you, Dr. Nikki, what led you to writing this amazing book, Rattled?
Well, lots of things. But early on in my academic career, I was working with patients with severe medical illness. And then over time, I became more fascinated with the silent patient in the room, their caregiver. So these are patients with cancer that caregivers are spending a lot of time taking care of them and often experiencing depression and anxiety as a result. Fast forward in my trajectory of working with caregivers, personally, I became a mom around that time, and I really thought my career was set. But from becoming a mom, I realized mothers are the ultimate caregiver, and there are not enough resources to help support mothers through this process. I'm an expert in treating depression, anxiety, postpartum, and I went through postpartum twice. So even I was not immune. And so I also wanted to break the stigma associated with seeking treatment and really share my story, because I went from rock bottom to thriving in a very short period of time. And when I went back to the science, given my academic background, I really put together the information that mothers need the most and uncovered a story that's not being told, but really everyone needs to hear.
Can you share more about, because I just want to normalize what rock bottom is. Can you share a little bit about your rock bottom? And I'm happy to share mine too, because I think it will help somebody listening.
I mean, for me, my rock bottom was I was in my closet crying, calling my psychiatrist. I had not slept for 5 days because my brain was on overdrive. And my son was in the NICU. This was with my second child. My son was in the NICU for 5 weeks. And then 2 weeks after that, we were on lockdown for COVID. And I was terrified. Um, and so I really just could not turn my brain off. I wasn't sleeping. I was terrified, walking around my house like not myself, crying, just really paralyzed with fear. And so that for me was my rock bottom.
And I guess what advice do you give to everybody here to prepare yourself for that moment, really? Because you can't really prepare yourself for that. I myself experienced a lot of really scary feelings when I was going through postpartum after both my babies. And I'll never forget this, and I've shared this once before on our page, but I remember I was standing outside on my front lawn and I was just spiraling. I mean, I was feeling so scared, and I had called my sister. Thank God she lived across the street. But for those who don't have somebody to come over right away, you need a plan. So I had her come over, and I couldn't even hold my baby. And it was the most terrifying time for me. And I had to get on medication. And once I did, I felt so good. But I think what's really, really important and what's so amazing about your book is you talk about creating a plan to prepare yourself before you have a baby. Because when you're in the throes of postpartum depression or anxiety or having any type of episode, I guarantee you are not going to start Googling a mental health expert to help you. You need to have something lined up. So tell us a little bit about like what people can do, I guess, to prepare themselves.
Yeah, it's a great question. I mean, I think I always say once you pee on the stick, establish care with a postpartum therapist or prescriber or both. I really talk about proactive mental health care planning just because no one goes into having a baby thinking, I'm going to get postpartum. It's going to
Right.
happen, right? So you have your mental health care team in place. And I think in decades to come, it'll be part of standard of care. But until we get there, the onus still falls on mothers to schedule their own mental health appointments. So just have it set up. And in this way, you can establish care with a provider that you trust, that you want to work with, should you need to or want to. And also, they can get a good baseline assessment of you while you're pregnant. And also, you can get depressed and anxious during the pregnancy period. And so, by establishing care, you're setting up your village for yourself just in case you need it. And even if you don't have clinical symptoms of depression and anxiety postpartum, you have an objective thought partner to sort of help you navigate this incredible transformative phase, right? It's a developmental phase becoming a mother, and we need to give it more attention and recognition the same way that we do for adolescents. And so, when I set up my care, it was in place. So I could call my doctor from my closet, and she was able to send in the prescription that day, and I was able to sleep that night. And so that was really helpful for me. You don't want to have to scramble last minute to find a provider. Sometimes you have to wait months for an appointment, and you need relief right away. So,
Right.
yeah.
I like how you mentioned the developmental phase, because that is something in your book that was new to me, and it's called Matrescence.
Mhm.
And I would love to know like your definition of matrescence. And then I underlined some of my favorite parts of that chapter, and I want to read it after you can explain to everybody what is matrescence.
Yeah. So, matrescence, like adolescence, is a developmental phase. It's a neurocognitive developmental phase. And during this transformation, they call it actually an adaptation. Your brain changes rapidly, fine tuning and priming itself for caring for a baby, right? So, you're growing all of these new neural networks around taking care of a baby, but you're also shedding useless networks that you don't need anymore. It's called synaptic pruning, right? So it's like Marie Kondoing your brain to give moms a leg
Love
up
that.
in caregiving. And, there's hormonal changes, biological brain changes, there's emotional changes, right? So I talk about the mom guilt, the mom shame, the mom rage. And then there's identity changes, right? You're a mother now. And so what does that mean for you? And it really calls into question a lot of things when you go through this in terms of, who am I going to be now? What kind of mother do I want to be? You sort of question everything, and you sort of relive your own childhood and how you were mothered. And it's just I think of it as a profound opportunity to sort of dig deep and support yourself through the process, because it can be incredibly profound. The mom brain is brilliant, and it's something that we should take advantage of.
I love in your book, it's all about empowering that time in your life instead of like feeling in despair,
Mhm.
right? The
Yeah.
parts first of all, I want to say 1 in 5 women experience postpartum. And that's really, I mean, that's jarring when you hear that. I mean, I want to say almost every single one of my friends experienced postpartum in some way. So I would just want to start off by saying the part that I found really profound was where you said, in this phase, mastering the usage of the word and is essential. For example, I enjoy my life with my babies and I miss my life pre-baby. And that sentence resonated so much with me and probably so many women, because when I first had my first son, that was the part that made me feel the most anxious. Was like I was losing my life. I was losing my identity at pre-baby, and it was giving me so much. I was feeling a lot of depression, but in the moment I didn't know I was even feeling depressed. I was just feeling these feelings.
Mhm.
And then you go on to say, I am a good mother and I don't enjoy every moment. And the part that you said, I need to take care of my baby and I needed to take care of myself first, that really helped me. And also you go on to say, and this might help a lot of other people, If your baby's inconsolable, we're taught to ask ourselves, how do I respond to this child? We should instead be asking ourselves, how are you feeling in this moment? And I'm just like, oh my God, yes. Like the amount of times that I was in my son's nursery and my baby was screaming unconsolable. And I remember my girlfriend was in the kitchen and she was like, hadn't had a baby yet. And she was like, I don't know how you do this. And I was staying really calm, but I was inside. I was like freaking out and I was going crazy. And I'm just like, God, if I had just for a moment thought about putting the baby down for a minute, and you even said go into like downward dog or, warrior pose or something to get yourself out of that headspace of panic, because then you can better treat your baby and problem solve. How do I get my baby to stop crying, right? And there's so much synergy with your book and honestly with the why I launched Mama Soul, because Mama Soul is all about the mom and the woman and not about the baby. There's a million kids sunscreen brands out there. But I was like, I want something to give to the mom to make her feel good and to give her a self-care moment every time she gets ready. And it smells like a subtle hint of lavender essential oil and it encourages you to take a deep breath. And with that being said, that leads us into something that you mentioned that you'd love to take us through a mindfulness exercise using Mama Soul.
I would love to. So first of all, I'm wearing the Shine lip balm. I like love it. It's
Thank
amazing.
you.
And also this packaging, I have to say, like it screams like this is luxurious and this is for me. Like it's not just like
Oh,
sunscreen to like put on your family. It's like I want to actually use this because it's a treat for
oh,
me. And
I
so
love that.
and it smells great. So when I was putting it on and using it, I was like, oh my gosh, that's brilliant to just put the lavender in it. Because how many times are we on the beach with our kids, like trying to get sunscreen on them? It's not relaxing to go to the beach with your kids, right? It's just not anymore. It's like the
No.
biggest disappointment that everyone needs to know and validate. Okay. So this is just a little slice of heaven while you're there.
Yeah.
Um,
Oh,
so yeah, so anyway, so when I was working in academic medical centers, I worked with a lot of patients in the ICU, and I noted, and there's research behind this. So nurses, when they care for patients, they're typically overworked in the ICU, and they don't have time between patients to sort of center themselves. But they have this relaxation exercises on the unit, and I used to do it too in between patients just to get myself centered. And basically, what you do is while the nurses are washing their hands, they're smelling the soap, they're breathing deeply into their belly, they're taking this moment to sort of reset. And so I thought that it would be great to run everyone through a little mindfulness exercise using the Mama Soul lotion because it smells so good and lavender is meant to promote relaxation. So,
before
I have
before you go any further, for anyone who's just joined, we're talking about ways if you're going through anxiety, depression, whatever it is, even if you're not.
hmm, can you hear me? Oh, okay.
Somebody
Yeah.
was
Okay.
sorry, I was saying it would be really helpful if you could do something to help get you out of that scary place in your mind. So this is something that we think you can do every day if you do feel, and whether it's using Mama Soul or using anything that feels calming to you. So go ahead. I just wanted to preface that.
No, that's great. And also, just to let you know, like in the book Rattled, it's a lot of practical skills like that just to get through the day to day for busy moms, right? You don't have a lot of time. So,
Well,
so what
also,
I,
while you're bringing up your book, just so everybody knows, at the end of this, whoever is the most engaged and staying on to the end is not only going to win the book Rattled, but you're also going to get to pick one thing out of anything you want out of Mama Soul's line, and we will send it to you for free.
oh, awesome. I don't know what I would, if I won, what I would pick because they're all
Face,
good.
body, or lip, guys, whatever you want. Okay, so go ahead.
Okay,
Take it from there.
so what I'm going to have everyone do is sit in your chair or wherever you're sitting, put your feet on the ground, feel the earth between your feet, right? Put, so I instruct my patients to put one hand on their chest and one hand on their belly. But in this sense, I just want you to start taking deep breaths into your belly Okay, deep diaphragmatic breathing in through your nose. Okay, breathe. And then I'm going to take the lotion and do this mindfulness exercise while I put it on. So first I'm going to smell it. What do I smell? Well, I smell lavender. It smells delicious, right? So I take a big deep breath and I'm bringing myself into my body. You know, what am I noticing? What do I hear? What do I see? What can I touch? So you're also noticing the cream, right? You've never paid this much attention to sunscreen before, I promise. But this is the mindfulness exercise, right? So I'm spreading it on my fingers and I'm noticing it's got this really nice texture. It feels really soft and it's making these nice ridges in my fingers. And I'm just noticing how it feels when I rub it. Yep, very soft. I'm going to breathe in again. Smells wonderful. Smells like I want to be outside at the beach doing this right now. Very relaxing. And so what you're doing is you're engaging your senses and grounding yourself. And this is a really common mindfulness exercise. And they say that anxiety and depression are disorders of time. So depression, you're worried, you're thinking about the past. Anxiety, you're worried about the future. So if we can bring ourselves back into our body, essentially there is no depression or anxiety. So we're trying to quiet our mind by grounding ourselves in our body. And so the way we do that is by engaging our senses. And so with this Mama Soul, what you can do is you can smell it, you can rub it against your skin, notice how it feels, but take those moments and really you can give yourself a little massage, right?
Love it.
On your
Yeah.
hands,
Yeah.
on your face, temples, like wherever, right? And just get into your
Yeah.
body and notice all of your sensations
Yeah. That's
that you're,
great.
yeah,
Thank you. Thank you for that.
you're welcome.
Jenna said, I wish I had that book the first 2 months of postpartum. I felt like such a bad mom and felt so guilty. I was mourning my old life.
Yeah.
Yeah. That's
Me
that's
too.
what I want to. Yeah, we all think. With that being said, I really want to talk about, we have a lot of stuff to talk about. We have to talk about the difference between baby blues and depression.
Mhm.
We want to talk about what mom brain means and the negative connotation that goes along with that, and how can we use that to really empower ourselves instead of having that negative connotation.
Mhm.
Mom rage, because that's a real feeling too. Mom guilt, and then also like back to work challenges, because there's a lot of women having to go back to work. What are some of the, the hardest things that women are going through, and how can you combat that? So first, I want to talk about, because honestly, when I was experiencing my baby, my postpartum, I was telling everyone that it was baby blues. But
Mm.
after talking to you, it was actually postpartum depression.
Yeah.
And because it lasted longer than 2 weeks, and mine lasted months. And so before
Yeah.
I got on medication, and I also want to talk about medication too, because I want to normalize that. I mean, and also I've met women who don't want to get on medication when they're breastfeeding because they're worried. But I also, I have my own personal feeling is, if you're not feeling good, like, you need to prioritize yourself more than anything, because your baby's going to be fine.
Mhm.
Okay. But let's talk about the difference between baby blues and postpartum depression.
So baby blues is very common. It usually happens, several days after birth, but it doesn't last longer than like 3 or 4 days and occasionally a little longer. But if it's beyond 2 weeks, you're not having baby blues. You're in the territory of wanting to get assessed by a
Right.
professional. Yeah, for
I
longer.
mean, I think baby blues sounds nicer.
Of
So I think
course.
a lot of people probably use that word and phrase instead of saying depression, and they don't want to say it.
Yeah. Well, because, you mentioned the 1 in 5 statistic. I mean, we in the field know that that's an underestimate, right? Because mothers are still afraid of reporting their symptoms for fear that they'll be viewed as unfit, right? There's still this stigma. And so it's probably way more than that. And mothers are probably like saying to themselves, oh, it's baby blues. This is a normal part
Right.
of being a mother. And this is also why it's important to get a professional that specializes in postpartum, because a lot of well-intentioned medical providers, dismiss patients all the time because they're saying, oh, it's just baby
Yeah.
blues, or this is just part of it, and really, if you're suffering, if you're feeling like something's off, just get an assessment, meet with a provider, let the doctors do their jobs. We want to take care of you. We want to take things off your plate, right? And diagnosing yourself should not be one of them. So talk to a objective provider.
Yes. And that's why I think this book would help seriously, like just so many women, because if you don't have, let's say you didn't get, you're in the midst of it right now and you don't have a mental health professional, but you have this book,
Mm-hmm.
it will really help you. I mean, I just dug in, and honestly, it is written so well. It's so relatable. I feel like so many women can benefit from this book.
Mm-hmm.
Uh, so with that being said, let's talk about what are some symptoms of postpartum depression,
Mm-hmm.
and when is it time to really call somebody for help?
So, yeah, I have a different perspective about the whole like give moms a checklist of
Yeah,
symptoms and see if, because it doesn't really, like, the screening tool that we use doesn't really capture the breadth of like what postpartum depression is. So this is why I say if you feel off, it's time to talk to someone and just let the doctor assess you. I mean, look, if you want to get into it and want to have an idea, if you're feeling down, if you're feeling hopeless, if you're, struggling to get through the day, I mean, obviously you're going to have sleep deprivation, right? But you can be depressed on top of that, right? And so mood is an incredible mood stabilizer. Sleep is an incredible mood stabilizer. And so that's why it can really trigger postpartum as well early on. And so, yeah, I like kind of shy away from giving mothers
yeah,
another thing to do by diagnosing themselves, but I really just encourage them if they feel off,
yeah.
what's the harm in like talking to someone about it and really seeing, because then they can do a more in-depth personal assessment,
I think
right? And
it's
there's
really,
also,
well, I also think it's important because let's just separate these two things, but they go hand in hand.
mm,
Feeling lonely and isolated when you're a mom can lead to depression.
right.
So some women might be like, "Oh, I'm just lonely. Like I'm just lonely. Like I just am isolated. I need to get out." Like, and I think that's where it's confusing for some women, because I myself felt that way where, I think it's really important to join a baby group,
Mm,
get yourself out there, and then maybe talk to other women who are going through what you're going through, and then maybe see comparatively,
mm.
if somebody else is feeling similarly to you. I don't know.
I think it's always great to have peer support, and find your village, and that's part of it. And also, just so you know, when we're depressed, we don't feel like socializing. We don't feel like doing anything. So you could be depressed and isolating yourself, not feeling motivated to do the things that are actually going to help you, right? So it goes both ways.
I I appreciate that. So mom guilt is a very big thing. I mean, I feel guilty all this. This is really important because I think women don't take care of themselves. I am
Mm,
myself am one of them, and I really have to force myself to go out and do the things, right, that would probably make me feel better, but then I feel guilty because I'm not with my kids. Can we just talk about how do you describe mom guilt, first of all, and like what are some ways to combat that?
yeah. So, as a clinical psychologist, I look at mom guilt on a continuum. So I'm going to look at how often are you experiencing mom guilt? How bad does it get? And does it actually interfere with your ability to do things, right? Are you not going out and socializing with your friends because you feel guilty? Like, is it driving behavior? Are you, not going to work out, right? Which would be great for you. Or getting a walk outside because you feel guilty leaving the baby. I mean, so I look at that on a continuum because yes, some mom guilt just comes with the territory, but if it's interfering with behavior, or if it's like it's excessive and like you're feeling it and it's very distressing, then you have too much mom guilt. And right, so one of my strategies that I talk about in the book is called the double down method for mom guilt. And I love it
Yes, I want
because
to talk about that.
I think it's just easy for moms to remember, like, no, I need to double down, because sometimes the thing you feel the most mom guilt about is the thing you actually need to be doing the most, right? Because that's actually what's going to improve your mood overall and then help you feel less mom guilt. Because if your mood is improved, you're just going to have less experiences of mom guilt. You're going to feel better mood wise. And so it's really important that you understand the connection between mom guilt and
Yeah,
mood, right? And
I mean,
so,
My husband always says he just joined. Hi, Mike.
Hi, Mike.
Um, Thanks for supporting.
Wait, my
Um,
husband's name is Mike too.
I love.
And we both have a son named Max, right?
Yes, we both have
Yes.
a son named Max and husband's name Mike.
Okay. Yeah.
Um, but I went to yoga or I come back from a walk and he's always like, you need to do this more.
Mhm.
And I always feel bad. Like, I'm like, I want to go with you guys. I want to go be with you guys. But then when I go, I'm like, oh my God, why didn't I do this like earlier and way more? Because
Right.
I come back and my energy is completely shifted. I'm a much better mother.
Mhm.
And so I think just like forcing yourself to get out and do it.
Mhm.
And then do it as an experiment if you're worried about, missing out time with your kids. But I promise you that 1 hour is not going to make or break anything and your kids won't even remember it. I bet you will. Yeah.
Well, 100%. And so when I say double down, I mean lean into it and make it as pleasurable as possible. So it's not just about you getting out and doing the thing. It's like, wait a minute, get out, do the thing. And it's not going to help if you're preoccupied and not like really physically, mentally there. So what is it going to take for you to get out of your head and out of the mom guilt to really experience the benefits of what you're doing? Like maybe you need to order your favorite food or get like a delicious coffee, or maybe you need to like, jump in the ocean, right? Or
Yeah.
jump in the pool, like really like engage in the present moment, right? Because or bring up a fun conversation with your friends or go see a funny movie. Like all of this is going to lift your spirits, improve your mood, and then overall you'll experience less mom guilt. And then it kind of builds on itself through the broaden and build hypothesis and theory that I talk about in the book. So I bring a lot of like science-based tactics into the book.
I love that.
Mhm.
Another thing that I want to talk about is mom brain. And I think just so many people give it like a negative connotation. It's like, oh, I have mom brain.
Mhm.
I did it myself. I mean, it's an excuse for feeling stupid at times. But how would you describe mom brain and how can we use it to empower ourselves?
So the mom brain is actually brilliant and needs a rebrand. Okay. So we're used to the derogatory term, right? Whenever a mother makes a mistake or has a lapse in memory, then it's like, oh, there goes my mom brain. But if it's not the full picture, right? So the subjective experience of mommy brain is feeling foggy, forgetful, and feeling interrupted. And that is very real. However, when we look at the research, there's not really strong support for differences in memory functioning between mothers and non-mothers. So what this means is that even though you feel like you're functioning worse, you're not, objectively speaking. It's just about, again, an adaptation and your brain feeling overwhelmed due to the increased mental load, right? You're taking on so many more responsibilities, so many more tasks, so many more problems and challenges that you're forced to rise to 24/7. And so, of course, your brain needs time to sort of catch up to that and build those neural networks. So it's an adaptation, it's a transition. And the maternal brain is actually brilliant during this process. And the reason you also feel foggy and forgetful is because of the lack of sleep.
Yeah.
So that's what we're mostly seeing.
Yeah. That's good. That's really good to know. And I think that will help some women when they use that term too.
Yes.
Um,
Oh, like I have changed it to when I do something really amazing or brilliant. Oh, there goes my mom brain. Like I wrote this book, Rattled. Mom
Ooh.
brain,
Okay, you
right?
know what?
I gave a
I
TED talk, mom
love
brain.
that. We need
And
to
so
do
I want
something.
to shift. I want to shift it. Like you started Mama Soul because of your mom brain. It's brilliant, right?
Okay, you and I are gonna have to talk about doing something about that because
Okay.
that is awesome.
Yeah, we'll just
Um,
do a whole
yeah,
marketing,
we're gonna do a whole thing.
a whole thing.
So the other thing I want to talk about, which is also very real for a lot of women, and I don't know that I personally experienced mom rage
Hmm.
per se.
Hmm.
I think I do get rageful when I'm PMSing. You can ask my husband, he'll tell you.
Hmm.
But can we talk about that? And also, okay, so Jenna said, oh my God, the word interrupted perfectly describes mom brain. If I don't say or do what I'm thinking in that moment, I will forget and say it. Yeah,
100%.
totally.
Yeah.
Um,
Because we're constantly interrupted. Like
const- oh my
it's,
God.
yeah.
Oh, just to tell a funny story, I was standing outside with this is just totally off topic, but I was standing outside with my neighbors the other day and I'm having a full on, and you know what, this is mom brain because I'm brilliant that I was able to do this. I was able to carry on a conversation with 3 of my neighbors while having a conversation. I would say that's mom
Wait,
brain. That's
I don't know if anyone, like, it cut
oh,
out for a second. So
sorry.
what was the?
I was saying I was outside with my neighbors and I was having like a full on conversation with like 4 of my girlfriends outside, and my son is obsessed with the movie Hook, and I started sword fighting him while carrying on a actually really good conversation with my
Right,
neighbors. And I'm going to
exactly.
coin that as mom brain.
100%.
I love
Like,
it.
there you are, improving with your son, right?
I love
Like
it.
let's think about what your brain's doing in that moment. You're tending to your son and engaging with him in an improv. You picked up on that, and you're going back and
Yes.
forth with him while also carrying on this high level conversation with your adult friends. And so, yeah, your mom brain is working on all cylinders. And
I'm brilliant. What
I
can I
mean, I
say?
just want mothers to understand, like, what they're doing in
Yeah.
any given moment is like brilliant, and they're working with a lot of brain power here.
Yeah, no, I love that. Okay, let's get back to mom rage because I do think women feel this and they might really scare them. And I would love to know what you classify as mom rage, and then also what are some tactics to suppress or help that, calm that feeling.
Yeah. So I'm going to look at mom rage on a continuum, right? So how often does it happen? How bad does it get? Does it interfere with like behavior, or does it really cause disruption, right? Does it become physical? Are you getting in like intense fights with your partner all the time? Like how, like, because on a diagnostic spectrum, it could be some, representing something that's underlying either like the overstimulation, right? Or anxiety, or feeling like, the anger part of depression. So it could be part of that, but it's really this intense emotional reaction, this rage feeling that goes from 0 to 100. It's more than anger. You can feel it in your body. And I think before you become a mother, you don't really understand what that
Yeah.
is.
Yeah.
But it's very common, right? But it's mostly due to like overstimulation, and they believe hormone changes. And so, with mom rage, I think of it as like an action potential, right? So like once it's fired, you cannot like do anything in that moment to make it better. The only thing you can do is not make it worse, right?
Okay.
So you have to kind of let it run its course in your body. But in that moment, I would want you to slow down, start taking some deep breaths, even leave the room, disengage from a conversation or argument that you're having, right? And like then recenter yourself, do some grounding exercises. There are things you can do there to help it run its course more quickly, right? So
What
that's
if you are home alone with your baby and you start feeling these feelings and you have no one to help you? What do you do then?
well, put your baby in the crib or, whatever safe place,
Yeah.
right? And just take some deep breaths, slow down your body. I actually say move your body in slow motion, right? It will pass, and just try to like, do less in that moment, right? Everything's moving so fast. You're going from 0 to 100, and you need to really just take a pause. Your baby's going to be fine, just like you can put the
What
baby down in the
what
crib.
you just said, it was I think for if I was experiencing that feeling, I think just hearing it will pass is
Yeah.
everything, because when you're feeling those horrible feelings, you just feel like you're always going to be feeling like this and you're never going to feel better. You're never going to feel like yourself. Everything's temporary, and I think that is so important. And I was just talking to a mom. We just did an event with a bunch of moms um, this past weekend, and I was talking to one. Her baby's like 4 months old, and she's really in the throes of it.
Mhm.
And she's like, "When does it get better?" And I was like, "It does get better." And I was
Yeah.
like, "It does get better. It gets amazing, actually." And for me personally, it got better around 8 months because then my baby was sleeping through the night.
Mm.
But with my second one, it got better after a week because I got on medication.
Yeah. Right.
So
Right.
it depends, but I think just reminding moms that it's all temporary. You're going to feel better. That is so important.
Well,
So thank you for saying that.
and another, I love that story. And another thing I want to mention is that when you're in an episode of mom rage, excuse me, it's not the time to figure out what caused it. It's not the time to think it through. It's the time to get out of your head and into your body and calm yourself down. It's not the time to yell at your partner and problem solve around what caused the mom rage and what he did or she did to piss you off, right? That can come later. You will come to it. You'll come back to that, right? Table it and just focus on yourself. Do less, be present, slow
I
your
love that.
body down and breathe
Amazing.
and let it run its course.
I love that. Before we go on to the next question, if anyone has, I just want to remind everybody, anybody staying on here, we're doing a giveaway at the end of this interview, and we are going to be giving Dr. Nikki's book, Rattled, away, along with anything you want in the Mama Soul line. You get to pick one thing: face, body, lip, your choice. You tell us once we choose who's the winner is. But you have to be following Mama Soul, so make sure you're following us, and you have to be following Dr. Niki Pensak. Do you want to give your handle just so everybody knows?
Yeah, it's at
You can
DRNIKKIP.
why don't you put it in the chat if you can?
Oh, okay. Yeah, sure.
And then I also want to talk about back to work challenges once you
Yeah.
put that in there, just so everyone knows so you can follow you.
Yeah.
But going back to work was one of the hardest things for me. I've shared this publicly. So when I was 5 months pregnant, I was let go from my job after being there for over 4 years. It was a horrible time when I found that out, but also the best time. I also shared because it's what led me to writing Mama Soul's business plan.
Mm-hmm.
But I was the amazing thing was I was able to be with my son for the first year of his life, and I wasn't working, and that was amazing. But it also made it a lot harder to go back to work because I had become so accustomed to just being with him. Also, at the back of my mind, a little excited, right, to get out of the house and to go do those things. But a lot of women they feel extreme anxiety
Mm-hmm.
and depression and, feeling like their world is ending. I promise you it's not. You're going to from my experience, and this is just me. This is not for everybody. I felt so empowered going back to work.
Mm-hmm.
I felt, and now, being that everybody can, work from home, a lot of us are working from home now. I didn't have that when I went back to work with my first son. Now, of course, I do. But it was, that it was hard being away. But when I got home, I was so much more present with
Mm-hmm.
my baby.
Mm-hmm.
So I just want to talk about what are some challenges that you hear back, like what are the feelings that some moms go through, and like what do you recommend that they do?
Yeah. I mean, I hear a lot of mom guilt, going back to work. And so that's when I bring in a lot of the strategies and the double down method and work with them on trying to, when they're at work, also being curious about their brain and how it's functioning now. And maybe they need to, schedule their day in a way where they have, it's called like activity planning and pacing. But basically, if you have more attention in the morning, schedule your higher order tasks in the morning and then maybe save the lower order tasks like answering emails and admin for later in the day. That's just like a very general example, but I talk a lot about, okay, you're in this new phase. You have to be curious about what that means for you, and you may work differently than before. Not worse, but different, right?
Yeah.
And so what does that mean and how do we better support you? And then also engage in maybe some more creative tasks or socializing, grabbing a coffee with a colleague, things that are going to help you, feel better about being at work and not just like thinking about the baby at home, and really get you out of your head. And so I do recommend that. And then I also talk a lot about this, and I spoke about this in my TED talk. A lot of mothers feel like they don't have anything to offer after they've had like, an extended leave, right? They were taking care of their baby. They haven't done like a work related task in a while. And so they're anxious about the adjustment back to work. And I want to really empower mothers to understand that even if they feel that way, that's just not the case. When you are taking care of a baby and young ones, like you're rising to relentless challenges. You are learning skills in terms of client satisfaction and leadership and problem solving and multitasking and building resilience in the face of very real stress. So all of these skills that you're learning in child rearing and taking care of a baby and managing a household and a family will translate very well going back to work. And so I want to empower mothers to feel confident with that. And then I also give some specific examples about how to talk to like your colleagues and perhaps your boss or whoever it is to negotiate, your work day so it works better for you when you go back to work after having a baby.
That's great. Thank you. If anybody has, again, if anybody has any questions for Dr. Nikki while we have her, her time is so valuable and we're so grateful to have you. The way that I want to kind of not end our conversation, but to round it out, what are some like top 3 coping exercises that you tell your patients? We've talked about slowing down, mindfulness exercises. You mentioned when we talked the 5 4 3 2 1 method, which I would love to hear more about. Listening to sound. You mentioned a few things. I'm going to let you kind of take it from here, but tell us some things that people can do when they're feeling really anxious. And again, this is for men, women, anybody to bring into their life and to incorporate into their daily routine if they're feeling anxious.
Yeah, absolutely. So, again, I'll just say the mindfulness exercises work great. Use your mama soul while you're on the beach and take that moment to listen to the waves and smell the ocean air. Also, smell the lotion. Notice how it feels on your body, right? And so, any of this mindfulness, exercise, any of these mindfulness exercises can really help you bring yourself out of your head and into your body, into the present. I would recommend the 5 4 3 2 1 method. I've talked a lot about that with my patients and on my Instagram, but it's basically like name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. And what it does is it forces you and act like you're a child and you've never like seen this thing before. Like you're not just naming like a pen, a book, lotion. You're actually looking at it and describing it in detail and noticing it in ways you've never noticed it before. And again, that's another really good exercise for busy moms, right? You're out, you're playing with your kid, you're in the playroom, and it's like you're overwhelmed. Okay, slow down. 5 things, start describing things, start really getting into the present moment. So that's another good one. And then listening for the most distant sound you can hear. You do the deep breathing while you're doing this. You close your eyes, and for a minute or two, you just listen for the most distant sound you can hear in the background. And maybe it's, a car or, a bird chirping or a voice down the hall, but you keep trying to go further and further. And again, that's bringing you further and further into your body and out of your head where that worry space is.
That's great. And then you said, and we talked about this earlier, but you said physically move your body in slow motion like molasses and
Yes.
breathe. And you said it's not an emergency, even though it feels like one. And that saying that, I'm telling you, these words are really powerful. When I remember having such bad anxiety, and I was like, I felt like I needed to call 911.
Yes.
And you don't. You don't need to call 911. There's ways to help. And your book, this, I'm telling you guys, I have a 3 and a 6-year-old, and I still found very valuable pieces in here that could help me now. And this is for all stages of motherhood. And yes,
It is.
it's written for postpartum and before postpartum as well. But it really is amazing, and I'm so grateful to have you on today. What I want to say, how would you summarize this book? This is how I want to end it. How would you summarize this book, and what can you find in this book that, because what I like to say, and how you mentioned it, it's a new perspective on motherhood.
Yeah.
So if you can elaborate on that a little bit.
Yeah, I mean, it's really a science-based, part narrative, part prescriptive. So I tell a lot about my personal story. It's meant to be engaging in that way. It doesn't read like a manual, right? So it's a roadmap to navigating early motherhood and all of the seismic changes that occur, the identity, the new emotional experiences, the biological changes, your marriage, right? That changes, right? That's
Oh,
stressful.
absolutely.
Back to work, and then also like how to take advantage of this period of profound neural development in your brain and harness it to your advantage so that you can come out feeling better than ever and thriving by using the cognitive boosts that actually come with motherhood to your advantage. We have so many barriers that get in the way with postpartum, with unpaid leave, with, the list can go on and on. Mothers are always used to, fighting uphill battles, right? And so how do we remove the barriers and really, in an information overload, saturated market, get mothers the actual science and information that they need? So I always say, like, in a world full of noise, rattled is signal.
That's great. And for those who can't afford seeing somebody like you, because not all insurance covers, which is really sad, but not all insurance covers your type of service. What is you mentioned a free resource that all moms can go and access. What was
Yeah.
that? What is that?
I always recommend Postpartum Support International because they have free groups for anyone, support groups, and they have a list of providers on their page that are certified in postpartum mental health. So, but even if you can't afford to see someone, either through insurance or without insurance, you can connect with their free resources. And so it's
And you
incredible.
mentioned that in your book, right, as well?
Yes.
Okay.
Yeah. Yeah. I think I give other resources, and I'm always posting free resources. I mean, that's how my Instagram started. I was just like, in the height of COVID, like, how do I get support for mothers? They need it. They're all alone, and like getting these virtual resources to them that are good, that are free.
Okay. So now it's time for our giveaway.
Okay.
Okay.
Exciting.
So Chelsea _ Christine, are you here? Can you message us if you're here? Chelsea? If we don't hear from you in the next 10 seconds, we're going to pick somebody else. Sorry. Okay. 1, 2, 3, 4, 5. Okay, I'm picking somebody else. Okay. S.W. Rosen, are you here? Okay, you know what? Here's an easier way to do this. Everybody who wants to be a part of the giveaway, send a message right now into the chat, and I'm going to pick out of those people.
What we could do is when you post it, have people tag.
I can do that too.
Way.
Okay.
Like if they follow both of us and then tag like 3 people who also need to follow us, then they can.
All right, we have a winner.
Okay.
Jenna, Sarah.
Woohoo!
You know what? You have been so engaging this whole live, and thank you for that. And so just what you can do for winning, and you can just DM Shop Mama Soul with your information, and we will get you that book. And just send us your address, and you get to tell us what product you want of Mama Soul. We are so excited to gift that to you.
Yay! Congratulations! Thanks for sticking around.
Yes, thank you. And Nikki, this was so awesome, and I just loved talking with you. It was so candid and relatable for so many women. So I just want to thank you so much.
Thanks.
Oh, thanks, Jenna.
It's great talking to you.
Yeah. I have a feeling this won't be the last one.
Yeah.
But thank you everybody for joining. And if you have any questions, you can follow Dr. Nikki. Nikki put her information in the chat. Nikki, you want to say it one more time what your handle is?
Yeah, it's at Dr. Niki Pensak. Should I put it in again?
Yeah, you can put it in again.
Okay.
But thank you so much. And I can't wait to honestly have you on again. And I can't wait to change that whole mom brain connotation.
We're going to read that mom brain.
Okay. Well, thanks, Nikki. It was so great talking with you. Bye, everybody.
Thank you. Thanks, everyone.